lenses in. Just take it out of the little package. The first thing you want to do is to try to see if it's inside out. And the way to tell is to put it up on the edge of your finger and look at the edge. If the top edge of the contact lens makes a nice cup shape, then that's right. When it's inside out, the top edge flares out a little bit. Okay, so now we've determined if the lens is inside out. And one thing I do want to tell you is don't worry about the lens being inside out. People get so panicked. I don't know. Is it this way? Is it that way? What should I do? If you put your lens on and it doesn't feel good, it's moving all over the place, it's probably inside out. Take it out, flip it the other way, and try again. If it feels good, that's right. Remember, before you go to put your lenses in, make sure you don't have an eye infection, your eyes aren't red, feeling uncomfortable, and that your vision seems okay. All right, so what we're going to do is, instead of putting it on the tip of our finger, which is what a lot of people are taught, we're going to put the contact lens right up on the side of your pointer finger like this. Okay? And near the end of your finger. Then what you do is you lean in towards the mirror. You use your right hand to put in the right lens. You're going to use your opposite hand to pull down your lower lid, just like this. See how my chin's down? Not like this with my chin up. Chin down, pull down, and then using the right angle, I'm just going to push the lens onto my eyeball. When I feel the lens is on, I pull my finger straight away, gently let go of my lower lid, bring my chin up. The lens goes right up into place. Now, I know a lot of you are taught to hold your upper lid out of the way and then do this. I think that's much harder. When you go to grab your upper lid, your lid's instinct is just to slam shut. And I think it makes it more difficult. So we find it more successful this way. I'm going to show you how to put the other lens in. The other thing that's a little bit different than I'm sure most of you learned is to put the left one in. I'm going to use my left hand. And I know you're all saying, I'm right-handed, I can't use my left hand. Yes, you can. Yes, you can. It works better because you're not coming across across your face at a funny angle. You're coming in from the same side. So, here we go. Up on the side of my finger, making sure my finger is not too wet. Just like this. Looks like it's not inside out. I don't see a rip on my lens. We also don't want to wear a lens that's ripped. If you think it's ripped, throw it out. Okay, so same positioning. Lean in, chin down, pull down my lower lid, push it on. Now, sometimes people start blinking here. You can also, at that point, grab your lid there and pull it up and use your lower lid to push the lens into place. Here we are. Great. Now, say you put your lens in and you're like, it's not really moving around, but it feels like there's something in my eye, or maybe there's something underneath the lens. One thing you can do is just move your lens around and see if it dislodges what's underneath it. So how you would do that is you lean in and tip your chin down again. Pull down your lower lid with the opposite hand. Take the lens, move it to the side, and then put it back in place.